Welcome to Direct Primary Care Benefits Podcast, your resource to understanding how DPC and the direct care model is fixing healthcare for employers and individuals alike. Learn from the most innovative and disruptive business executives, brokers, physicians, and healthcare influencers that are in the trenches, changing the way employee benefits are being administered across the country. I'm your host, Brett Shoemaker. Well, welcome to Direct Primary Care Benefits Podcast. This is your host, Brett Shoemaker, and this is episode 13. And I am excited today to have a guest all the way from right here in Houston, Texas, but somebody who definitely is no stranger to the direct contracting space. But I've got Dr. George Ozoude here with me today, who is a sports medicine orthopedic surgeon. So George, welcome to the podcast today, man. Glad to have you here.
Thank you, Brett. Thanks for having me.
Yeah, absolutely. Well, we've got a lot to talk about today. George and I met at the Fulshire Katy Chamber Health Expo, right?
Yeah, there was a health fair a couple months ago.
Yeah, absolutely. And I saw George, and for those of you that are listening, some of you were actually shooting this live on video, but George is a tall, fit, good-looking guy, and you just look at him and say, man, this guy must have played some professional sports. And then I found out he was a orthopedic surgeon and launching his practice, and had been in the space here and practicing since 2014. So I said, man, this is definitely somebody we got to have on the show. So I appreciate you making some time to come out and make it happen.
Absolutely. I'm excited to share my journey. So
yeah, well, George, let's hop right in. So you actually were born right here in Houston, Texas.
Yep.
At Herman Hospital, right?
Yep, back when it was called Herman Hospital.
Yeah.
The Memorial came along.
Yeah, there you go. And George actually then moved to New York City at 4 years old. But he actually comes from a line of physicians. His father is an internal medicine doctor, yep, and his mom is a family nurse practitioner. So for all of our listeners out there, George, as you know, we speak to brokers and employers primarily and really educate them on not only the direct primary care space, but the direct contracting space, right? Orthopedic surgeons, surgeries, and connecting them with surgery centers, which are obviously, as we know, more affordable means of healthcare and what have you. And so talk to us a little bit about what your dad does as an internal medicine doctor, kind of qualify that, and then your mom as a family nurse practitioner, and then let's dive into some more direct contracting stuff.
Sure. Yeah. So my dad has started his internal medicine journey as a resident in Brooklyn. You know, like you said, I was born here along with my siblings. When he was in between medical school and residency, he was moonlighting here in Houston. And then he landed a residency spot in Brooklyn, and that's why we headed to New York City. So that was the start of his internal medicine journey and our New York journey. And, he held a couple of jobs out of residency, but then ultimately started his own practice in Queens, New York City, where we were raised. And funny enough, his practice is mainly a direct pay practice because he works with a lot of immigration healthcare.
Oh, nice.
Yeah, so I didn't even really think about it till I kind of got into my journey, but I'm really following in the footsteps.
Oh, wow.
So he has his own private solo practice, takes a lot of direct pay, immigration, healthcare type of work. And he has his, main patients as well. He's privileged at several hospitals around the New York City area, so.
Nice.
Yeah.
So does him and mom work together, or does she work for a hospital system, or?
No, they don't. She helps him out. And when he was first getting started, she was a little bit more involved. She actually went back to school. Amazing woman. She went back to school and got her nursing degree as well as a nurse practitioner degree.
Oh, wow.
Within the last 10 to 15 years. So.
Oh, wow.
She kind of always wanted to do medicine, but raising kids, and I had older sister, younger brother, so she was not really stay-at-home mom per se, but she was kind of focusing on us while doing a full-time job. So amazing. She went back, and now she's working for, funny enough, I think it's an orthopedic practice in Queens, New York.
Oh, wow.
Yeah, she works and she works kind of in that orthopedic family medicine type of setting, so,
okay,
so she's in an employed position.
Nice. All right, cool. Well, as I mentioned, George and I met, and we were talking a little bit about the whole direct primary care model. And George actually started, so you went to fellowship right here at UT Physicians here in Houston.
Correct.
And you were on kind of on the north side, right? Humboldt, Kingwood area.
Yep.
And so you started there, and then tell me a little bit. You ended up doing mainly, was it Was it through? I know you've done a lot with the high school, so tell me a little bit about that and how that all that took place.
Sure, yeah. Like I said, I came down here for fellowship, did a 1-year fellowship down in the Med Center with Baylor College of Medicine and UT. So I had, privilege of working with really talented faculty from both of those programs. And afterwards, I started my career as a employee with UT in the northeast part of Houston, Humble, Kingwood, at the Memorial Hermann up in that region. And that was an excellent experience. I got to walk into a well-structured machine where I had, the privilege to take care of high schools in that area. Humble ISD schools, New Caney ISD, Sheldon ISD. I'd say a total about 10 different high schools I was working with as their team physician.
Wow, I love it. So when you do, obviously orthopedic, when you mentioned labor and tears, obviously me being a baseball guy, I'm going to ask this question.
Yep.
So did you mainly do, was it football was mainly most of the injuries that you dealt with?
Oh, no, we saw everything.
Yeah?
Literally, we saw everything. And football was different just because there are state regulations that require a physician to be at the actual games on the sideline.
Okay, so you were actually at the game on the sideline.
Oh yeah, from Thursday to Saturday, I was busy during the fall. But
people thought he was a football coach. I'm sure because you're looking like a football coach.
They tried to give me some pads and a helmet and try. You got eligibility to that?
Yeah, you got eligibility. Get your booty on the field.
No. So yeah, that's the only one where we're required to be there.
Okay.
The other sports we don't have to be there. I would go anyway, just because I'm a sports guy,
Yeah.
and I enjoy being around the community, and it's great community up there.
Yeah.
So, but yeah, we would see injuries from all across all the sports.
All the sports. Okay,
Yeah.
gotcha. So you didn't see, not that you didn't or couldn't do the other sports, but did you see more injuries in the football space, or whether was football is the primary? What do you see? I'm just curious what the kind of the percentages is like.
Yeah.
60% football, 30% baseball, 10% swimming.
What it really kind of boils down to is actually the type of injuries you see in different types of sports.
Okay.
So yes, I see what you're saying is that football is such a high impact type of sport, and definitely we get a specific type of injury that we see from football.
Yeah.
And a good amount because these boys are big. My God, I don't know what's in the Lake Houston water, but
yeah,
they are some big boys out there, and they're running and hitting each other hard.
Yes.
But you do see a spectrum of injuries that are more football or more soccer or more baseball, where it's kind of more overhead. So we see a different spectrum. You see more fractures that associated with football. Funny enough, you see ACL tears. You see a high amount in female sports, women's sports.
Soccer.
So soccer, volleyball, basketball. So we get a lot of those knee injuries from there too. But sure enough, we get ACLs from football as well. So
gotcha. So you did that from 14 on until I guess just recently, when you just recently started your own practice. So congratulations, first of all.
Thank you very much.
Yeah, I know that's entrepreneur journey is always a fun, exciting, and then scary thing all at one time.
Scary.
Yeah.
Oh my God.
Yeah. But is it just you? Are you married? Kids? Do you have no kids?
Not married, no kids.
Okay, so yeah, you're good. So you don't have too many extra.
I say my
constraints.
business is my baby. I'm trying to raise that thing.
Yeah. Yeah, definitely. So first of all, like I said, congratulations. But what inspired you to kind of go off on your own? Because obviously, it sounds like you were having some fun doing that, right? Being around the sports guys and gals and doing the thing, and I can totally see you just having a good old time there. So what inspired you to just kind of take the plunge?
I'll tell you, I did have that goal initially starting out to kind of, be within that academic and community setting. That was my idea of what my career would look like. And I would, go up that academic / corporate ladder, right? I didn't know it was corporate back then. I just knew it as the academic ladder. I wanted to teach. I wanted to be around young minds. I wanted to be in the community. And I would say within 4 years, I kind of started seeing the true business side of medicine, which we don't really appreciate when we're in training.
Yeah.
We're just so focused on, learning and, surviving, that when you're in training, you don't really think about the numbers and the impact that it has on a deeper level until you get out in practice and you start seeing kind of all the red tape that healthcare all the headwind that healthcare faces.
Yeah.
I really started seeing the impact it had on my patients. You know, the time that I would get to spend, or the time that I wouldn't get to spend with them in clinic to kind of educate them about their conditions. You know, I really started seeing friction, you know, and coming from a medical family, it really means a lot to me having that MD behind my name, you know, and that was not in alignment with what my vision was for being a doctor.
So was it because whenever you're doing surgeries, they kind of want you to do a lot of surgeries and they don't really give you the ability to spend the time, and which I'm assuming what you're saying is kind of like a direct primary care doctor, whereas, you know, they spend time not just directing or assessing and taking care of that sick need, but also the preventative side of it, right?
Yeah.
So is that what you're talking about, like the preventative side? Like, so after you do their surgery and they've already made mistakes of maybe how they're training or how they're working out, like you want to now say, hey, now look, guys, when you're doing this, do it like this. And when you're, you know, form-wise, is that what you're saying?
It's a mix of things, right? It's partly that. It's also the fact that you can't take care of the patient the way you envisioned. If a patient needs a certain test, diagnostic test, x-ray or MRI, or medication, you face so much headwind just to provide that standard of care. You know what the standard is as an MD, but the model, the corporate model, where there's all these intermediaries that are in between you and the patient, they get in the way of that efficient flow of care, right?
Yes.
So many friction points, you know, and so this kind of has an effect on bottom lines and financials. Therefore, you know, in order to kind of make the whole system work financially, you have to see more. So it becomes volume based, right? Where I don't necessarily feel volume based is the answer. You need more time with patients, going back to what you were just talking about. You need the time to explain to them what's going on and what are their options, and, you know, how their recovery can be optimized and things like that. Or even if they, you know, don't have a surgical problem, you need time to kind of explain to them what happened and how you can prevent it from happening again. So that preventative side, like you said. Nice. And then you need good workflow and work balance within your office. And so when everyone's kind of just running around with all this friction in the way, it just becomes a stressful environment for the staff, you know, for the physician, you know. There's just this, you know, lack
churn
of
and
quality.
burn.
Yeah, this is churn and burn that kind of makes it feel like you're not really accomplishing what you came to accomplish.
Yeah.
And so, yeah, it's a combination of things.
Yeah, I got you. Well, it sounds very similar to the whole direct primary care model and why doctors want to go to that space. So It's interesting because I just was at this Free to Care conference. Shout out to David Ballat with the Free to Care movement out in Austin with the Texas Public Policy Foundation. But you know, there was cardiologists there, and you're seeing all of these different types of specialties that are now moving to this direct contract space, which kind of opens the door for us to bring up that conversation. So us obviously speaking to employers and brokers that are out there in the space, advisors that are starting to look into this model of direct contracting, what would you say to them, right? Because there's a lot of apprehension because there's, you know, I think there's a little bit more work involved when you're designing these plans, right? But what would you say to them as to why it's worth taking that plunge and making that, taking that risk if they're an employer or if they're an advisor or broker out there, why it's worth really selling to their employers why you've got to go this route? I mean, obviously you and I both know it's better care, but what would you say to them to really inspire and encourage them to move in that direction?
I mean, there's many reasons, but honestly, a big reason for them, it affects their bottom line. You know, the cost of providing healthcare benefits to their employees should they go through the commercial insurance route is just astronomical and getting worse.
Yeah.
You know, every year these brokers come back and they tell them that the premium's gone up, right?
Yep.
So I think that should get the attention of business owners, you know. You know, it actually affects your bottom line. Like, you can pay much less for the cost to take care of your employees, in their health conditions.
So for that to that point, let's talk about that for a minute, because you obviously saw surgeries that were done by, and a lot of municipalities, a lot of school districts are starting to move to this method of care, right? And which obviously puts a huge competition out there for these huge medical systems. It's funny because when I go to these different expos or whatever, they look at me and you can tell they're like they know what our big push is right now. So I feel like there's a little friction there, but maybe it's just in my mind. But what is the kind of the price difference for a school district or a municipality that is getting these surgeries done? Can you kind of give a little context as to what those price variances are, right?
Yeah, I think you can kind of look at it from two angles. You can look at it from the perspective of the employer, and then from the perspective of like the doctor and the patient. So from what I understand, the cost to insure or cover a employee with their family, of course, can be $10,000 to $12,000 a year.
Oh yeah, easy,
right?
Easy.
And
probably closer to 16 if you're doing a family. Probably closer to 16.
Bigger family, right? Yep.
Yeah.
And so I think from what you can accomplish by going direct pay or going self-funded, you can cut that in half, 50%. You can decrease that spend, and this is important because the healthcare spend for employers is among the top 3 line item expenses.
100%.
Behind payroll and probably maybe rent or something else.
Yeah. Usually 2, but yeah, you're right. Payroll, you're right on cue.
It's up there, and so especially in this economic environment that we're now entering, where layoffs are going to have to be considered by a lot of employers, right?
Yeah, you make a great point. I mean, as a matter of fact, just them reducing their healthcare spend could keep them from having to lay off.
Correct.
Employees.
Correct.
That's a good point.
Those funds can go to so many other places, right? Research and development, holding on to employees, or if things are looking good, giving your employees raises or hiring more talent, right?
Yep.
So it's huge. That's the employer perspective. On the physician and the patient side, I would just put it with plain numbers. It costs in Houston about $18,000 cash pay to do a total hip or a total knee. That's it. But if you kind of get into the games that are played on the corporate side, it's so variable. The range can be from 80 to 100,000, depending on nothing really. Is depending on randomness.
So crazy.
It can be a different hospital. It could be a same hospital in the same hospital system in a different location. There's no rhyme or reason.
I just hear these numbers all the time, and it just blows me away because these hospital systems created, I guess it's because they created the buildings and people just trust the buildings, but it's like at the end of the day, at one point before all these big hospital systems came into play, there was a surgeon down the street that had a practice. I just don't understand. What do you think caused these surgeons to say, yeah, let me go work for this hospital system? I guess just so they didn't have the stress and strain.
Conditioning.
Yeah?
Yeah, we're risk averse by nature. That's our physician brain at work.
Okay.
It to your earlier point, it requires kind of stepping outside the box.
Yeah.
Creating another parallel system that operates and functions differently. This is risky.
Yeah.
It requires some pain, some scary moments, and we're paid well. We're well-paid professionals. Even with the headache, we're still well-paid professionals, and that's kind of just the easy button. And we're conditioned to kind of press the easy button.
Yeah.
Right?
And then also, though, but I mean, if you're self-employed, so to speak, like I would imagine, even though because at the end of the day, when you're a physician working for those big hospital systems, even though they're billing that 50, 80, whatever, 100,000, whatever it may be, they're not giving you that.
Nope.
Yeah, that's going to the system. I would probably venture to say that you're probably not even getting the 18 that you could get on your own. You're probably not even getting that.
Nope,
when you're
absolutely not. So the stat I'm aware of is 7%, which is the percentage of all the healthcare dollars that get spent in America.
Is what goes to the physician.
What goes to physicians. And if you poll people, they'll think it's like 30%, 50%.
Yeah, they think it's more.
Yeah, they think it's just the physician that's robbing them. No. It is not us. And so that's the other big thing of the direct pay model, the free market model. Even though we're charging the free market price, which is significantly less, we as physicians are taking home more. You make more as a physician.
Yeah.
And not more in the sense that I think we should all be greedy physicians. No. We're compensated for high level of service that we provide. We're appropriately compensated with the free market model.
Yeah, but not only that, you want to be able to care for the patient. So moving in more and digging deeper there, like if what I love about what we're doing right now, and this is what, it's so challenging. It's so funny. I interviewed a benefits advisor, and she's part of Mitigate Partners, Christy Gupton, and she was saying, like, I think we have the hardest job in America. And I would say that it is pretty difficult, man, because you're really changing a paradigm, right?
Yep.
We're completely changing a paradigm of how healthcare has been done. And it's so funny because everybody, they ask, I had somebody ask me just the other day when we were doing a presentation, do you get a card? And I'm thinking, like, who cares? Like, do we get a card? Like, I can give you a card, but we've been conditioned that if we have a card that says Blue Cross Blue Shield or United or whatever, like, that's insurance. And it's just crazy.
Like it's a credit card.
Yeah, like it's a credit card. Yeah. And the truth is, it is a credit card. It's a credit card that's giving the healthcare cartel a bunch of money. And they're really not footing any risk or any bill. The employers are paying this, right? Yep. And so anyway, so I digress. So, when you look at the care side, and what I really love is to where this model is going is it's creating a situation to where if you're an employer out there, right? Let's just pretend you didn't save a single dime on healthcare, right? But your people paid zero out of pocket,
right,
for all of their needs. Like, I don't know about you, right? But I've got John here, my camera guy that's back here. But John, if you could have healthcare that you had provided for by an employer and you had zero out of pocket, which obviously we know that's not what it is now, how exciting would that be?
Pretty exciting.
Yeah, that'd be exciting, right? So if that's exciting and that keeps employees there, which it does, right? And I never realized, because me personally, I guess being self-employed over the last, this is, doing what I do now in the direct primary care space with First Primary Care has been, like maybe the second W-2 position that I've had in like 15 years. And I'm loving it now. But like, I didn't go and look for this position. I personally didn't care about benefits. So I was a little kind of blind to the fact. But
right.
what I've realized is that people look for benefits when they're looking for jobs. And if you as an employer can provide a benefit that says, hey, you've got top tier access to a direct primary care physician and surgeons if you, God forbid, ever need a surgery or a hip replacement or a knee replacement, especially if you're dealing with older manufacturers and, in the manufacturing space, and you've got older employees that might need hips and knees and things of that nature. And let's just pretend, which we know that it's going to save them a dramatic amount of money, but let's just pretend it was the same. Your employees would not go anywhere if you could save them money out of pocket.
Absolutely. Yeah, no, it's huge. I think it's one of the biggest factors that someone would look for when looking for a job, right? They would look at the benefits. And I think that speaks to just how difficult it is to navigate the medical landscape as a patient today, right? You know, that's an easy button for them. Like, it's hard for a patient to wrap their mind around, being responsible to the point of figuring out the medical finances and things like that, and just how to navigate a really difficult landscape. And so they look to the benefits. You'd be able to attract the best and the brightest, hold on to them. That would be a great situation for an employer.
Yeah, absolutely. And so, I mean, that's the thing. So if they would be willing to take the risk.
Oh, yeah. They just want to be taken care of.
Yeah, they just want to be taken care of. And I think employers get a little scared because it is a risk, right? Like, anytime there's change, right? Nobody likes change, right? But if they told them, if they really understood that, look, this model could keep money out of your employee's pocket or keep money in your employee's pocket, then that's going to be a huge driver.
Absolutely. And then on top of that, another layer is this model can keep patients healthier. So it'll decrease the need for all the health care that we provide now, because you get that preventative side.
Yeah.
And obviously the top 5 conditions that U.S. citizens are dying of are all chronic preventative diseases.
Yeah.
So you just lower the burden all across the board when you kind of have this model. You'll have more physicians stay within that primary care specialties. Right now, a lot of physicians specialize because that's a whole nother, craziness where it's just so expensive to get medical education as doctors that we kind of forced into these specialties. And that just kind of, decimates the primary care space. And that has impact on, your employees' health if you just don't have enough physicians and they're volume based and they don't have time to go over preventative measures, So it all has this interconnected effect.
Yeah, absolutely. So when we talk to employers, you know what? I just thought about this as I was sitting here listening. I was like, man, I need to have George. We need to have you come out when we're doing employer presentations and doing. We do a lot of lunch and learns, right? Where we educate employers on this model and how it works. And I'll bring our founder, Dr. Goyle, out there, and basically, because anytime you have a physician out there, it just makes it, so much more. I don't know if it's believable or people buy into the whole model more. But I think when we're dealing with our larger employers, and I'm even thinking right now when we deal with some of these insurance brokers, when we come in there, having you come out and speak to that, because, I think the more exposure that they have to physicians and surgeons that are operating in that space, and they know that, hey, this is somebody here local. Because, think about it, right? Like, you're somebody who used to work for Memorial Hermann, right? And so you're one of those. So you got to see on the inside as to, just because that name is there doesn't necessarily create or mean quality of care. Because I'm sure, speaking of which, let's talk about that for a second. So when you have these physicians out there, like how many, like just in your area, your group, or so to speak, how many physicians were there like that were also doing orthopedic surgeries, similar to you? Like, was there 10? Was there 100? Was there 50?
Regarding the location I was in, or
well, not
group,
just your location, your group, your area. Like how many orthopedic surgeons are there that work for Memorial Hermann, just kind of in that area or bandwidth of Houston that you were in?
There were about 6 to 7 of us.
Okay.
There were more from other groups, but just within UT Memorial Hermann system, about 6 to 7 of us. Okay.
And did you see, like, just with your, and not that you want to throw anybody under the bus or anything, we obviously won't say any names, but did you see like some of the surgeons were really passionate about that care of the patients, and then some of them were just kind of like, hey, I'm just here, just do my thing and get up and get out? Like, did you see that?
Yeah,
that spectrum.
You see the spectrum from the time you start residency.
Okay.
Like, it's not even throwing anyone under the bus. It's not a knock on any, individual. It's the system. Okay. We all go in with good intentions, but then when we get exposed to the actual system, you got a choice to make. You're either gonna get jaded or you're either gonna just not align. And I think you see that from the time you get into residency, throughout training, definitely throughout your career. You see some who go one way and it's just like, it is what it is, right? And then you see others who are like, nah, this ain't right. We can do this better. We can do this different. Something doesn't really align with, what I had envisioned for my career. And so you see both of it. And like I said, it's the system in my mind. I look deeper, not just at the individual, like what's behind that behavior. To me, it's the system.
It's the system that drives them to feel a certain way, whether they're happy, unhappy, what have you.
Burnt out, fired up.
Interesting. I love that. So that's interesting. Yeah. And I guess what you're saying is right, because even in corporate America, I was the same way. I was a fired up, energetic guy until I got burned, so to speak. And then I was like,
dang,
never again.
Right.
Same
like for me.
Yeah. Never again. Like, and I think that was so hard. That was one of the things that was so hard, because when you go back into getting a W-2 position, right? Like, you're like, man, am I gonna have that same thing happen to me again, right? But I've been very happy, with what we've got here. I think working for a startup, I think anytime you're in a startup environment, right? Even though we've been in business since 2016 and we've been doing this, we're one of the biggest and the best regionally, like, there's still that startup environment, right?
Yeah,
You're still,
it's a different vibe.
Yeah, it's a different vibe. And you're also, especially, I guess, with what we're doing in healthcare, we're fighting the good fight for...
The cause is huge.
The cause is huge, right?
It's a huge, noble cause. So that brings a different type of energy to the workspace, right?
Yeah, absolutely. Yeah. And it has a different level of accomplishment. So,
right.
Dr. Ozoude here, so your practice right now is in Humble?
Yes, same area. It's northeast.
So let's talk a little bit. So they can get in contact with you, obviously, on LinkedIn.
Yes.
Right. And then your website, you want to give your website out here?
Yes,
so they can...
Absolutely. You can reach me through my website. You can see all our content up there. We have transparent pricing for, clinic visits,
Get out of here.
clinic procedures, and surgeries. Still evolving process, but that is up there. That's one of the key bases, foundations for
Transparency.
Can you imagine?
I love it. Transparency. Unbelievable.
Yep. So that's Movement Orthopedic. Movement spelt as is, and then Orthopedic spelt with the old English way for a little fanciness. So that's
Little bouginess
little
there.
bouginess there. ORTHOPAEDIC. So movementorthopedic.com.
Yeah, I like I said, when I first saw the website, I'm like, man, does Dr. George, should I tell him that it's spelled incorrectly? And then I went and looked it up online, and I was like, okay, no, never mind. Okay,
We good.
Yeah, they got it. And so he wanted the class. So for those of you that want a classy surgeon, okay, there you go. You've got him right here. And for those of you that are watching this on video, I want to encourage you to watch it on video so you know the type of individual that is going to be putting their magical hands to work. And so before we close out, Dr. Ozoude, I want to just talk and say, hey, how in the world can you do these surgeries, man? Like, just let's talk about that, because I mean, I've seen, the little orthopedic cameras and going in there, but like, you don't get like nervous or scared or like I would just like, you're working on somebody's knee or like shoulder or like how do you keep composed and like I don't know.
Yep.
Not drink too much caffeine or so
Right.
you're not too, I mean, what?
I tell you, my first ortho surgery that I saw, I was a first year medical student, and I went to the surgery 6:30 in the morning, total knee replacement. I'm just a tired, hungry, poor student, and I'm in this case, and they actually let me scrub in. I was not expecting that, so I'm sterile field in like right next to all the action. I started, getting faint. Lights started getting bright, started sweating. I felt like I was going to pass out. I literally had to break scrub, and just everyone's looking like, what's going on? What's wrong with the medical student? Guys, I got to go to class. I used some excuse, and I literally, that was my first experience with live surgery. And I went into lock. I hope this is not like my death sentence here.
Yeah.
Death sentence here. I hope I can go through with this. Luckily enough, that never happened again. I'm just very comfortable in the OR. I love the team aspect of it. There's so many moving parts.
Yeah.
You're like the captain of that ship.
Yeah, you're kind of leading the ship. It's like scalpel, right?
Yep. And the music's going, and everybody's having fun. It's not a nerve-wracking experience. I do get fired up in a good way, like anxious in a good way about new cases that are complex.
Okay.
Or present like different unique challenges.
So you like the challenge?
Yeah, not necessarily new cases, but
you like the challenge?
Or rare cases.
Okay.
That come across those. Yeah, I get a little extra level of angst.
Amped up.
Yeah, amped. For those. So.
Yeah, because you're like tackling something that, all right, let me do this. I mean,
like big case, long cases. I like those. Big case. I like them all.
Nice. Nice. Well, that is exciting. Well, look, man, I just want to say thank you again for coming out today. And again, for everybody out there, we have been talking surgery, we've been talking direct contracting, and really we were talking patient care today. So for those of you that are out there and want to hear from a surgeon that is in this space, loves this model, wants to see more employers and advisors and brokers moving to this model, you've heard it today from Dr. George Ozoude right here in Houston, Texas. And I want you to all go check out his LinkedIn, check out his website. We'll put it on the show notes. And again, man, thanks for coming out. And I'm looking forward to us tackling. I feel like I've got another partner here. Are you on Facebook, by the way?
I am. I'm on all the social media platforms. I'm personally on it, all the social media practices.
Okay, I need to add you too. So we've got a group that I'm starting, that I started. Like, I think that's beautiful. Like, I almost get kind of like, I don't want to ask this man how much he charges, right? Type of thing. But like, even that's crazy that we would even. That's crazy because
let's normalize that. Right?
Yeah, let's normalize the fact that say, hey, before you touch my leg or my knee, how much does this cost?
Absolutely.
Right? Yeah, let's do that. All right, cool. Well, again, thanks for coming out today. I'm excited. I'm excited about doing this some more in the future. So, guys, you have heard episode 13 of Direct Primary Care Benefits Podcast. This is Brett Shoemaker. I appreciate each and every one of you for listening and really encourage you guys to go out, give us a positive review. Check out our YouTube channel. We're growing our YouTube channel. We put all of our audio recordings, we convert them to a video file, and obviously when we have the a privilege to have live people in audience. We have video as well. So go check out our YouTube channel and subscribe, follow, show us some love if you got some value. But I appreciate all of you listening and helping us on our mission. And our mission is, you wanted to say this with me, Dr. Ozoude? Fix healthcare, okay? That's what we say, okay? So thank you for listening, and thank you for helping us strengthen and grow our mission. And that mission is to fix healthcare. All right. Well, thanks for joining. Everybody have a great day. God bless. We'll talk to you real soon and hear you next week. See you, everybody.